crashing is pretty much unavoidable in mountain biking, what are the ways in which serious injuries from crashes can be avoided?
I think for me, if you are in a sport that you know you're going to fall over a lot, learn to fall over. Which again, seems really daft, but it's what we do with athletes that fall over a lot, right? So, if you go to judo, right, where you spend a lot of time getting sort of thrown on your back, you learn to fall over, and you do like roly polies, and you roll around, and you kind of learn to kind of fall over from your knees and tuck your arms and sort of roll around and kind of get your shoulder out of the way, that kind of thing. I don't think cyclists do that enough. Cyclists kind of like fall off their bike at, whatever sort of discipline, and instantaneously stick their hands out, right? And why do we see kind of wrist injuries and shoulder injuries from that, right? Now, there are some circumstances whereby it just happens so fast that you land how you land, right? But obviously, if you can mitigate for that, it definitely kind of makes sense to do so, right? There are some people that crash really badly, fall over really badly, and every single time which they fall over, they do significant damage. And then other people who have the exactly sort of same crash, but have spent their whole life sort of falling over, and actually come away with sort of minimal damage, right? So that, I think, actually genuinely is sort of part number one. So actually upskilling your ability to fall over, which again makes complete. It doesn't make any sense when you actually say it like that, but the idea, as I say, is to again build that proprioception, build that body awareness, so that when you then do fall over, the body is again wrapping itself up, so you're less likely to kind of generate sort of significant injury. Certainly, then what we look for again are robust models, right? So cyclists in generally tend to be disproportionate in terms of strength, lower body to upper body. Again, different disciplines are sort of slightly different because of the demands of it. It means there's not a lot of sort of, structure around joints, around bones to actually look after them when we actually slap off. So, one of the things is actually just to kind of get a little bit of just muscle mass through there. And that's not just doing beach weights, so not just doing kind of presses and, sort of curls, not just getting a six pack. It's also doing kind of pull movements, so training the back of the body, as well as then the intrinsics as well. So rotator cuff work is really important. Rotator cuff is basically the sort of active stability of the shoulder. We know that shoulder is at significant risk, same as hip, from getting bashed. So the more stable, the more structurally strong the kind of shoulder joint can be, the better.
So I've heard people say tuck and roll when you crash. Why is that important with regards to avoiding shoulder injuries?
So when we talk about cyclist injuries, the sort of common one is collarbone. A part of that is because any kind of impact on the side, we're fairly rigid. If you land straight on here, it's a fairly rigid structure. So that force just basically gets transferred. So there are sort of two things that are sort of fairly weak there. So you can damage this joint here, that's called your AC joint or acromioclavicular joint. Okay. So your when we talk about collarbone, it's your clavicle. So this is your clavicle, and the acromion is this bone. So that's the bony point that you can feel on the top of your shoulder. So you can dislocate that joint, and that's basically where the collarbone basically just pops up. So you basically tear all the ligament structure around there. If it bypasses that, it goes into the collarbone. So that's then when we then sort of snap the collarbone. And that's basically because, as I say, it's fairly rigid, whacking it on the side, and then that transfers through. If you then land with your shoulder in a slightly awkward position, so the typical one is where you land with your arm outstretched, and it basically pulls you up and forwards. You can then dislocate your shoulder. See, that's then when you then dislocate that joint there. So that is your glenohumeral joint. So your humerus, so your humeral part of that. And then the glenoid is then the socket that it sort of sits in. That's then where we then sort of dislocate that. It's part of the reason why it's actually kind of quite important to tuck when you land, and ideally try to get the shoulder out the way. So obviously if we land more on the back of the shoulder will essentially wrap itself around, and you'll basically dissipate force. We might get a little bit of soft tissue structural injury sort of through here. And, as with everything, there is always risk of a fracture. So, the scapula is a little bit more sort of exposed. But, like, scapular fractures happen significantly less often than glenohumeral joint dislocation, AC joint dislocation, and collarbones. So in terms of sort of risk factors, landing directly on the point of the shoulder, fairly high risk. Landing with a sort of awkward outstretched arm, fairly high risk. Landing on the back of the shoulder, slightly less risk. So again, that's then why falling over or learning how to fall over is actually kind of quite important. Then when we then talk about how the shoulder sort of creates structure, like you can see all these sort of orange things, they're all the sort of ligament structures. And there's quite a bit of sort of ligament structures through the shoulder. The issue is it's designed to move, right? So it's got all this sort of scope of movement. So it's actually a fairly mobile structure. So even though it's got quite a few sort of ligaments, it's actually fairly mobile. And actually a lot of that comes from what we call the congruency or the depth of the joint. So the ball in this joint is 1/5 encapsulated within the socket versus the hip joint, which is 4/5 encapsulated, because obviously the hip joint's a loaded joint, right? So it's a similar kind of ball and socket sort of setup, but because it's loaded, it's far more sort of congruent. What it means then in terms of the shoulder is we've got a lot more sort of active structures around it that basically help to support and control the humeral head. That's our rotator cuff, right? So we have a couple of muscles that kind of sit through here, one muscle that kind of sits over the top of here that sort of runs through this gap here, and then one muscle that kind of sits in sort of underneath here, right? And that basically kind of controls the rotation, hence why it's called the rotator cuff, and basically creates sort of structure around sort of that joint. Now, regardless of sort of what shoulder injury you kind of get, you'll almost always get a disruption to the rotator cuff. Similarly, vice versa, obviously to create a more robust shoulder, having a stronger or a more stable rotator cuff massively matters. Now that's not, can you produce a huge amount of force, but it's about the efficiency, about the quality of how that works. And in particular in the deceleration of that movement. So basically decelerates the humeral head. When we then crash, of course, having a stronger rotator cuff means that structure is stronger, it's more stable. So not only can we affect the way in which we land on the deck, so i.e., what structures are more at risk, we can also then affect how actively strong, actively stable, robust the kind of shoulder joint, shoulder girdle is, and then also then improve our post-injury recovery, right? So generally speaking, the kind of strongest structures are, the easier it is to then sort of recover during sort of rehab process. So, one of the things that we would sort of look at is, sort of taking those sort of at-risk areas and going, right, well, how do we be preventative with that? So as we go to shoulders, we know that a good, strong, stable rotator cuff, good, robust rotator cuff, massively matters. So obviously, the way in which we sort of, sort of improve that is by training it. So we would give you a, sort of prehabilitative rehab program. Then obviously sort of post-injury, it's exactly the same. So we then go and look at sort of what structures are injured, in what way are they injured, what direct treatment do they kind of need, how do we refer through the sort of multidisciplinary teams that might be, surgeons or what have you sort of involved within that sort of decision-making process. And then we then rehab it. And again, that rehab would again focus on, shoulder function, in particular around sort of rotator cuff. So rebuild the internal structure, and then obviously then create that structure sort of externally. So again, you've got a little bit more effectively padding to like whack the floor with. Does that kind of make sense?
That's really good actually. I think that'll be really helpful to any rider who's almost certain going to fall off at some point.